to have a press conference to really talk about homelessness. As you know, the legislature had appropriated $12 million and given us the flexibility to spend it in the appropriate places. And we've been working since the legislature adjourned and have come up with how we would intend to spend the money to help reduce homelessness here in the state. We do know and we see homelessness every day around our community. It has reached each and every community, and this plan does respond and provide services across the state. I know that there was some discussion about Senator Chan Oakland being here. I don't see her, but just wanted to acknowledge her for her commitment and all the time that she has spent on this issue. I just wanted to thank Director Wong and Homelessness Coordinator Scott Morishige and their teams. They really have worked hard to put together this plan that truly focuses long-term. You know, as I've said from the very beginning, there is no quick fix to homelessness. There is no shortcut. It really is about being focused, consistent, and driving to make a difference each and every day. And with that, I'd like to introduce Rachel Wong, Director of Department of Human Services.
Thanks, Governor. Thank you, Governor. Good afternoon, everybody. One of the reasons why I was asked to come here today to preface and provide a context. Oh, can I acknowledge Senator Chan Oakland, who just came in?
Sorry, Susie. I thought you just missed.
Sorry.
No. Thank you.
Well, I do want to take a moment, Senator. Thank you. Governor, what we're getting at is thank you for your longtime advocacy, championship, and just stewardship over looking at the issues that relate to human services, to homelessness, and housing. I think it's very appropriate that you're here today. Thank you. But what I wanted to do on behalf of Dr. Pressler, the Director of Health and DHS, to provide some context for when we talk about homelessness, how this fits into some of the larger framework that the state is using. Many of you have not had the opportunity to hear about Ohana Nui, which means extended family, which is the shared framework that Department of Health and Department of Human Services is using. Dr. Pressler and I, along with two of our deputies, just came back from the Aspen Institute last week. And Hawaii was one of the 8 states that was selected to participate in this. Ohana Nui for us is a best practice model that's been adopted by the White House, by the National Governors Association, by the Kellogg Foundation, Aspen Institute, many different organizations nationally and in other states. For us, it's a multi-generational approach that invests early and concurrently in children and families to improve health, education, employment, housing, and other outcomes. It's really looking at the social determinants of health that we talk about. When we talk about moving Hawaii to a healthier place, which includes housing, which includes moving the markers on education, employment, well-being, we're talking about the social determinants of health that are access to health care. It's being able to get a job and to keep a job. It's being able to live in a clean environment, access to healthcare services, and housing. And so that's why we talk about this in the larger context, and we have both departments that are moving forward. What you will be seeing in the near future is, the linkages between the social determinants of health and our investment in children and families concurrently. What we're moving towards is programs, policies, interactions with the community, that it's no longer just about children or just about adults. It's blending our programs together, our funding streams, that it's more in a more efficient way. Governor doesn't cost anymore. But what it is about bringing everything together with this lens over it. And you see us investing in children 0 to 5 because that's truly where the greatest investment is, the return on investment. We now know the science shows that 90% of your brain is developed by the time you're age 5. So when we talk about this is the chance when the governor talks about changing the trajectory of future generations, we have the opportunity to do so by investing in children and families together. It's about moving children and people out of toxic stress environments. The research shows with the ACE study, Adverse Childhood Experiences, that children who are growing up under toxic stress environments, whether it's hunger, whether it's abuse and neglect, or homelessness, that it actually impacts their health throughout their lives, leading to an earlier chance of death. So that's really why I wanted to provide this framework, because what you'll see is when Scott comes up and talks about the state approach, the governor's approach to addressing homelessness, and what we use to inform the use of the disbursement of the $12 million that represents the administration's request, you'll see this in the larger context. So with that, I'd like to turn it over to Scott Morishige, who's going to talk about how this all aligns with the governor's values, of working together, true collaboration, bringing aloha into all we do and doing the right thing. So thank you.
Well, thank you, Director Wong. And I wanted to thank, the governor also for really empowering me and my staff and Department of Human Services to go out into the community, get feedback from service providers, from other stakeholders, to really figure out the best way to allocate the resources available to us. The plan that we've come up with really builds on the existing work that providers do every day in our community. And you can see the hard work that providers have been doing reflected in some of the encampments that have been coming up in the urban Honolulu area. There's been a lot of discussion, I know, about the Kaka'ako Makai encampment. And a year ago, before I started this position, there were over 300 people residing in Kaka'ako Makai. It is one of the largest homeless encampments in the nation. And then the state came together with the city and county, with service providers and others, and really used a coordinated approach to address that situation and to help move people into shelter, but more importantly, into permanent housing, ending homelessness by getting people into homes. The approach that the reason why I reference that is I think it really reflects the overall approach that the state wants to take to address this issue. We know that when we look at the recent point-in-time count data, the number of unsheltered homeless individuals, more importantly, the number of chronic homeless individuals has continued to increase. And we know that's the direction where we need to focus our resources, and we have been focusing our resources. How we've addressed the situation in Kaka'ako starts with a public safety response. We know that we want to keep individuals in these areas safe from harm. Sometimes these encampments have become unsafe for the homeless individuals residing there. So when we go out with sheriffs and the Department of Public Safety, other state staff, we always want to make sure that we're accompanied by homeless outreach workers. So when we go to enforce the park closure hours in the evening, it's not just to enforce the rules. We go together with outreach workers to provide connection to services and connection to housing. And through that approach, we've been able to successfully, over the past year, transition over 280 people into shelter and permanent housing. And I wanted to take some time before we get into the details of the plan to really acknowledge some of the organizations, homeless outreach workers, as well as shelter providers that have helped us with this approach, because I think they really exemplify the approach the state is taking to address homelessness in our community. So we will be issuing certificates of appreciation to these providers to acknowledge them for their efforts. And I wanted to call up these groups, your organization and your staff, and we can present a certificate for you on behalf of the Office of the Governor and my staff. And we really appreciate the work that all of you do in the community. You are the folks who are on the front lines every day dealing with this issue, and I know it involves not only going out during normal business hours. Many of you are out in Kaka'ako and other areas of the island from early in the morning, 5:30 a.m. to 11:30, sometimes past midnight. Doing everything you can to bring access to people who have fallen through the cracks in our system, and really making sure that they can get the stability that permanent housing provides for them. So I'll call up each organization by name, and then we can present certificates to you and your staff on behalf of the governor. So I wanted to start off by calling up the staff from Waikiki Health, from the Waikiki Health Caravan Homeless Outreach Team, as well as the Waikiki Health Next Step Shelter in Kaka'ako.
I know.
Thank you.
No. And thank you for your efforts. I really wanted to acknowledge Jason Esparro, who's the director of the Caravan Program and Next Step Shelter, as well as Kiani Cockett, their program coordinator, for all of their efforts. The next organization I wanted to acknowledge is the Kalihi Palama Health Center, and particularly their homeless outreach team.
It's a lot of us. Stay right there. You want me to stand in front of us?
I'm going to take a picture now, but then if we could do ones afterwards when we get ready.
All right. Okay. Not sure I stand.
And I particularly wanted to acknowledge Kalihi Palama Health Center's outreach supervisor, Jennifer Tehotu. Jennifer and her team have gone out to every area of the island, really reaching out to those who need help the most, providing them just a helping hand to get them into housing and really building that trust and rapport. It's something that doesn't happen overnight, and it takes repeated encounters sometimes, but it's been part of the solution, part of how we've been able to successfully transition so many individuals into permanent housing over the past year. The next organization I wanted to acknowledge is the Lighthouse Outreach Center in Waipahu. Thank you, Bill. Bill Hummel is the supervisor of Lighthouse Outreach Center. When we first started our efforts in Kaka'ako, many of individuals were sheltered at Lighthouse, and they really work closely together with the state, lowering barriers to shelter to increase access to entry. And the Lighthouse shelter also is a training ground for social work students to build case management experience, get hands-on approach to addressing this issue, and I really want to thank them also for being part of our efforts. And last but not least, I wanted to acknowledge the Institute for Human Services, their outreach and their shelter team for all of their work in supporting the state's efforts in Kaka'ako and also other areas of the island. No, and under the leadership of Connie Mitchell, IHS really has expanded their program and their range of services so that they're not just shelter, they're not just outreach, but they offer a whole continuum of services that support the transition to permanent housing. Both IHS and Kalihi Palama Health Center administer rapid rehousing programs that help provide people a little bit of rental assistance to stabilize in their homes. And rapid rehousing is one of the components of our state framework that you're going to be hearing a little bit about very shortly. I really just wanted to acknowledge the hard work of these providers again, because like I mentioned, the framework, the state's approach you'll be hearing about really builds off of what we've been doing and what we've been investing in over the past several months. So at this time, I'll go into a little bit more of the details of the state's framework and specifically how we'll be allocating the $12 million appropriation from the legislature. So this framework I'll share has been guiding our work from the very beginning. And we know that this approach works, and we know that it's what's needed to get people into permanent housing. We also know that this approach really will help us to better address those who are unsheltered, who we visibly see on the streets and sidewalks, the population that has been falling through the gaps of our traditional system of services. So the way that we've approached this is really looking at our whole system of homeless services and trying to identify key leverage points that are necessary for us to address to really get people on the path to permanent housing. And the goal of the state's framework to address homelessness is to build a truly housing-focused system, a housing-first oriented system by 2020 over the next 4 years. And it will really take a coordinated effort across all levels of government, across service providers and other community stakeholders to really make sure that we have a truly coordinated system that focuses on permanent housing end goal. So no matter how someone enters our system of services, that the common goal is to get people connected to permanent housing as quickly as possible and not only get them into housing, but provide them the right level of support so they can maintain that housing. So the 3 leverage points that we've identified, I'll go over them one by one. And the first one that I'll start with is affordable housing. And when you're looking at how you're going to end homelessness, you can't end homelessness without providing people homes. When the state talks about affordable housing, we recognize that there's a need to develop additional inventory. So one of Governor Ige's goals is to develop 10,000 new units over the next 4 years. We're very appreciative of the legislature, separate from the $12 million, for providing funding in the capital improvement budget to help us support this goal, and also providing allocation of funding to the Hawaii Housing Finance Development Corporation and the Rental Housing Trust Fund. We're working very closely with state agencies, including HHFDC and the Hawaii Public Housing Authority, to see how we can develop new housing inventory at every level of affordability. In addition, it's not just about building additional housing, it's about maximizing the existing inventory that we have, because we know that it will take time to build more. So we've also been reaching out to landlords in every part of the state. We've been working closely with all 4 counties to convene landlord summits, to engage landlords to help us in addressing this issue and open up their units so that we can pair them with the vouchers for Section 8, for Housing First, and other rental assistance programs that are available. And we have been seeing progress as a result of this. So that's our first lever that we identified. The second lever is health and human services. And we know it can't just be the efforts of Department of Human Services alone or Department of Health alone. It's really looking at the two in alignment. And also focusing on evidence-based practices that we know work, that have been proven to be effective in communities across the country. So in terms of allocation of $12 million, the biggest portion of the $12 million is directed in this area of health and human services. So we're directing a total of $9.4 million in this area. And to complement our affordable housing efforts, we've set aside $6 million in new funding for rapid rehousing. So I mentioned that we do have some rapid rehousing programs in our community right now, offered by some providers, but there's a need for more attention in this area. We know for individuals who have income and just need a little bit of a extra boost to help them transition from homelessness into homes, the rapid rehousing approach works. Rapid rehousing, for those of you who aren't familiar with it, is providing a short-term financial assistance anywhere from as low as 3 months to as much as 24 months if that's needed, provided with wraparound supportive services. The state's intention is to target rapid rehousing at individuals in our existing emergency and transitional housing facilities to increase efficiency within our shelter system, and also to give these families the support so they can move into permanent housing as quickly as possible. In addition to investing in rapid rehousing, the state is also expanding our investment in housing first, in permanent supportive housing. So this is for the individuals who are chronically homeless, who often have very significant mental health or substance abuse issues that need not only long-term housing support in terms of housing assistance, but also need wraparound case management services. For the past few years, we've implemented a state housing first program on the island of Oahu that has helped over 100 people transition to permanent housing. We're now going to be expanding this program to the neighbor islands so that we can offer this intervention in every part of the state. We know that homelessness is not something that's isolated just to Oahu. It's something that we see in Maui County, Hawaii County, Kauai County, every part of Hawaii. So we want to make sure those resources are available for those on the neighbor islands as well. We also wanted to set aside funding for homeless outreach. When I acknowledge the work that the providers have done in Kaka'ako and other areas of the island, a critical part of how we've been able to reach people in a lot of these public encampments is through the work and efforts of outreach workers. But we need to expand our investment in this area. Outreach workers are the first point of contact, how we reach individuals who've been unsheltered, sometimes for decades or more. And as I mentioned earlier, it really takes them not going out just one time, not two times, but really going out repeatedly to build a relationship with someone, to understand each individual's unique needs so that we can match them to the most appropriate types of services. So we're committed to allocating an additional $2 million for homeless outreach statewide to build our capacity not only here on Oahu, not only in Waikiki, urban Honolulu, where we know we have visible homeless encampments, but also in every part of the state. In addition to providing homeless outreach services for adults and families, we also wanted to carve out a portion of this funding for homeless youth. We know this is an issue that really is starting to surface in recent months, and we want to address dedicated funding for that specific population as well. We know that many youth are not eligible for some of the traditional services, and it really takes special effort to build rapport with that population as well. So we wanted to make sure that we provide the resources and the support that's needed for that. And finally, we know something that we've seen in the data also is an increase in family homelessness, unsheltered family homelessness. So we've been working hard over the past year on establishing a family assessment center in Kaka'ako. We know that there's a lot of interest in that project, and we will be providing updates in August for those of you who are interested on just an update on the timeline and progress of that facility. But a portion of the $12 million is also allocated to that effort. In the Health and Human Services piece, just to summarize, we want to invest in homeless outreach so that we can reach out to those who are most vulnerable in places that often are isolated, where they may not be able to get access to traditional services. And we also wanted to allocate funding in the Family Assessment Center to help more quickly transition people through our state shelter facilities, as well as invest in rapid rehousing and permanent and housing first, permanent supportive housing options, so that we can stabilize them and provide the support and follow-up that's needed to help people maintain housing. Because as I mentioned earlier, it's not just enough to get people off the streets. We have to keep them in their homes, make sure that they're not falling back into homelessness. And then finally, the third lever that I've identified is public safety. And this is a lever that sometimes is the most controversial. And I want to be clear what I mean by public safety. Public safety is the state's term for being able to respond to encampments in public spaces and make sure that these areas are safe for individuals who are residing there, so that we can keep these areas usable for the public and the community as a whole. We know that we're seeing a growing number of encampments on city and state properties that are often restricted areas because they're unsafe areas for people to be. These are areas such as our Diamond Head State Park. We have homeless encampments on the side of the mountain where it's not a very safe area. We have homeless encampments in other areas where the conditions really are unsafe for the people living there. So as I mentioned earlier, government does have an obligation to respond, and we work very closely with our law enforcement officers from the Doe Care Division of DLNR, the State Sheriff Division, as well as the county police in all 4 counties. But when we respond, we want to make sure it's not just a law enforcement response. We want to make sure that this is linked to the other 2 levers, to housing and human services. Because again, the goal is not just to move people around from one area to another, it's to provide them the right level of support to get them off the streets quickly and to keep them in their homes. So under this public safety lever, we're allocating out of the 12 million, approximately 1.9 million. That includes almost $1.5 million for our state property owners, DOT, Department of Land and Natural Resources, and the HCDA to be able to provide property storage as well as cleanup efforts to address some of these encampments. And we're also providing additional funding for the Sheriff Division, approximately $450,000, to assist them in their law enforcement response to some of these areas. When I talk about these 3 levers, I want to emphasize that it's not enough for us to press on any of these levers alone. We need to really focus on all 3 of these areas simultaneously. For example, it's not enough for us just to build housing without providing the services for people to be able to maintain that housing over time. Also, it's not enough for us just to invest in services without providing the housing inventory for people to go to. And we cannot just have only a public safety or an enforcement response, because that would just move individuals from one area of the island to another. We really need to be focusing in all 3 of these areas at the same time. And it's through this comprehensive approach that the state hopes to be able to really continue the forward momentum that we've seen, really be able to address the unsheltered homeless individuals, those who are chronically homeless, who we see on the streets and sidewalks, and get them off of our streets and sidewalks and into permanent housing and provide them the stability and support that they need. Finally, if you've been adding up the numbers in your head, you probably realize all of this does not add up to $12 million. So the last portion where we're allocating resources, we're allocating about $675,000 for data and infrastructure. Because one of the things that we know is we need to look at our performance as a system. How is our system, our community, not only the state, but efforts by the counties, service providers, and private funders, how are we doing in addressing this issue? So we need to establish clear performance metrics, and we really need to invest in data. So the state is allocating $325,000 for the homeless management information system, so that we can strengthen our data analysis, increase our reporting functionality, and provide training to service providers on the use of this new system. In addition to that, we're also setting aside a portion of funding, $350,000 for state-owned shelter facilities for necessary repair and maintenance, but also for assistance in planning for the potential conversion to permanent housing of some of these facilities that currently serve as transitional shelters. And we have 8 state-owned facilities on the island of Oahu. So again, through this comprehensive approach, we really are looking at providing the housing that we need to get people off the street, providing the right type of services that's individualized to everyone's unique needs, investing in outreach so we can reach those who, even those who are living in the valleys and mountains that sometimes we don't visibly see. And lastly, we're investing in public safety, making sure that we can maintain our public spaces and make sure that they're safe for everyone, not just members of our community as a whole, but sometimes the homeless individuals that these areas sometimes are not safe for. So again, I really wanted to thank the service providers for the work that you do. And I also wanted to thank our partners at the other counties for really aligning their efforts to the state to achieve our common goal of establishing a housing first system by 2020, and really thank the governor for his support of both myself and Director Wong. Thank you.
Thank you. Director Wong had to run off to another meeting, and I just wanted to thank her for being here at the beginning. I thought it was very important for her to provide the framework that we're bringing together, Department of Human Services, Department of Health, to address homelessness. So with that, open to any questions you might have, focusing on homelessness first.
Is the split roughly 50-50 between Oahu, the funding split, 50% Oahu more or less, and the other 50%?
Yes. Yes, it's $1.5 million to maintain the existing state Housing First program on Oahu, and $1.5 million to expand Housing First efforts to the other counties.
And same thing for the social service outreach and the other categories?
So for the other statewide efforts such as rapid rehousing and outreach, the funding will be allocated proportionally to the various counties. The State Department of Human Services does have a request for proposal that we'll be releasing in the early fall, where all of these services will be contracted out and providers across the state will have an opportunity to bid. These contracts will start in February of next year, February 2017.
Scott, I don't mean to sharpshoot the plan, but what it looks like is you have a 4-year plan with 1 year of funding. How does that work?
So we realized that the appropriation for the legislature was a 1-year appropriation. So when we were really looking at the use of it, we wanted to invest in our capacity, to strengthen our capacity with a one-time allocation. So that was the reason for investing in data, investing in state repair and maintenance. That's a one-time appropriation that we can make. We also made the choice that we wanted to scale up existing programs that we knew were effective, such as outreach, rapid rehousing, and Housing First, and use the next year to gather data to demonstrate the effectiveness of these programs so that we can go back to the legislature to request continued funding with the data to back up that request for funding for these services. We know that Housing First and rapid rehousing have been effective not only here in Hawaii, but in communities across the country. This is an approach that's endorsed by the U.S. Department of Housing and Urban Development, as well as the U.S. Interagency Council on Homelessness. So we wanted to make sure that what we're doing in Hawaii to align this to address this issue is really in alignment with what's happening at the federal level as well as across the country.
But by providing permanent housing for the homeless, you're displacing people and making them homeless.
Well, that's why we really need to look at all of the 3 levers that we identified: the affordable housing piece, the health and human services piece, and the public safety piece, all 3 together. When we're talking about affordable housing, it's developing affordable housing and maximizing inventory, not just for individuals who are homeless, but for everyone at every level of affordability. We know in Hawaii that we have not just a homeless crisis, but a housing crisis across the board. So we need to really look at this comprehensively, and our efforts are focused not just those at the lower levels of affordability, but making sure that we can really add more inventory for our broader community as well.
What measurements do you anticipate using to show this is, how close to the legislature?
So when we looked at how we evaluate the effectiveness of these programs, we really looked at how does the U.S. Department of Housing and Urban Development measure systems performance of communities. And one of the things that HUD focuses on is permanent housing placement. So similarly, what we'll be looking at is the number of individuals who are able to move into permanent housing, and the number of individuals who are able to retain permanent housing for 6 months or more. In addition to that, when we're looking at evaluating our public safety efforts, we're really measuring it in how many individuals are we able to make a service connection for, how many individuals that we encounter during a park closure enforcement, for example, that we're able to connect to services and support that get them on the path to housing. So just as we've been collecting data in Kaka'ako that shows that we've assisted over 280 over the past year, we continue to look at that same type of data as we measure our performance moving forward.
Scott, I have to ask, because we've had certain cases in the news over the last year or so where agencies, certain people people have diverted money, misused money that was supposed to go to help the homeless and the needy, and they diverted it for the personal use. What safeguards are in place to make sure that we've got, you know, checks and balances and the money's gonna go to where we want it to go?
So first of all, I really wanted to to acknowledge the legislature for not only providing additional funding for us to address this issue, but for providing additional staffing as well. The legislature, in addition to appropriating the $12 million, also provided additional positions for the Department of Human Services Homeless Programs Office, which administers these contracts, as well as for the Hawaii Public Housing Authority, so that we can better implement existing programs such as our state rep supplement program. By having additional staff resources to be able to assist with monitoring of all of our existing contracts, as well as focusing on data through the investment in the homeless management information system, we'll be able to really provide proper oversight and evaluate our providers not only on the good use of funds, making sure that they're being used for the purpose necessary, but really to evaluate their effectiveness. How effective are these providers in meeting the permanent housing goals that the state is establishing through this new framework?
Okay. Other questions?
Do you know yet how money will be split between the service providers? Homeless outreach $2 million. How is it going to be divvied up?
So as I mentioned earlier, the State Department of Human Services will be releasing a request for proposals, or RFP, in the fall, in September, and through that competitive process, we'll be soliciting proposals from providers across the state. All of our existing contracts for homeless services expire either at the end of this year in December or the ending of January. So the RFPs that will be coming out in the fall will be to procure providers for all of these various services administered through the Department of Human Services Homeless Programs Office.
Scott, can you talk about the 1.4 million in cleanup that will be coming for the state? You know, the state doesn't have the same infrastructure that the city does.
Okay, so the 1.4 million is being split between the Department of Transportation, Department of Land and Natural Resources, and the Hawaii Community Development Authority. That funding provides those agencies, the state landowners, with the ability to provide property storage in the same way that the City and County Department of Facilities Maintenance crew does, as well as with the resources to be able to conduct cleanups in these various areas of the island. In addition to the $1.4 million appropriation, as I mentioned, we're also increasing the resources for homeless outreach. And we know that we need the outreach workers as well as the cleanup resources to be able to respond to these encampments. Because ultimately, at the end of the day, when we respond, it's about people and really building relationships with these individuals and getting people into homes, getting people connected to the right level of support that they need. And that's really where we're focusing our resources.
Private companies like you're doing like HPDA.
Yes. Yes, I think.
Building a state.
So what we're doing is providing the resources for each department to respond appropriately. And we are looking at using the way that Hawaii Community Development Authority has worked with contractors to implement this work as a model for other departments to follow.
How open are you?
As far as the cleanup and maintenance efforts, I think it varies depending on area of the island and different jurisdictions. I know we need to really have a comprehensive approach, and we know that in some areas you may need to respond just once, but in many areas, like I mentioned, it really is about building relationships with the unsheltered individuals that are there, building trust and rapport. These are people who fall in through the cracks of our existing system, some of them who have not had any relationships with service providers in a number of years, some of them who do not have a family support system. And when outreach workers go out there together with our state teams to respond, it takes time to build that relationship so that people trust them enough to give them the information so that they can do a proper assessment of their situation. So it's something that we're not going to solve this issue overnight. It is going to take time, but we wanted to make sure that we're allocating resources now so that we are able to respond and able to respond to the growing number of unsheltered homeless individuals throughout the state, because we know that's an area where we need to begin to target our resources.
Governor Egan, how does your emergency proclamations and your task force on homelessness fit into this plan? Are they now obsolete?
No, it is consistent with the plan. Obviously, we do know that leveraging federal, state, county resources gives us the maximum probability of success. You know, I do meet with the mayors frequently to talk about homelessness, as well as the congressional delegation. So, you know, we have been working through trying to identify the different people and resources to be engaged, and they are engaged. So, you know, we are kind of rolling through execution, I guess, at this point. It really is about defining roles and seeing how we can all support each other.
And does your emergency proclamation need to be extended?
We will be looking at it right now. It ends in August, third week in August. So we are assessing and evaluating whether it would be necessary to extend it again.
And Scott, at this point in time, can you give us a handle on like a priority of what you folks think is the next largest problem area? You know, you talked about Kaka'ako with 300. Is it under the viaduct? Is it Blaisdell Park? Is it Wahiawa?
Well, we really need to put equal emphasis in every community, and that's partly why we're increasing the allocation of resources so that we can provide better geographic coverage, not only in terms of homeless outreach, but in terms of the other services such as rapid rehousing and housing first. So we really need to press on all fronts. My office, similar to the city and county, responds to complaints that come in, you know, from the public, or calls that we receive about people who may need assistance in different areas of the island. So if there are individuals in an encampment who need assistance, you can contact my office. The number to reach us is 586-0193, and through that number, then we can coordinate with the city and county, other counties. If the jurisdiction is not state, we can make sure that we send an outreach worker to assess the situation and also contact the appropriate state landowner to respond as well.
Are we doing anything in conjunction with the feds if there are, let's say, homeless camps on federal land that they may not be aware of?
When jurisdiction comes up that's not state jurisdiction, we do contact the appropriate landowner to try and coordinate efforts as best as possible.
Are we doing anything with the feds at this point?
Not currently at this time, but as we get concerns about different areas of the island, we would contact the appropriate landowner, whether it's under federal jurisdiction, private jurisdiction, or under jurisdiction of the counties.
What's the status of Waianae Boat Harbor encampment? I heard most of the state has or negotiating kind of a deal with it.
So the state, my staff, as well as staff from Department of Land and Natural Resources have been meeting with individuals residing in the Waianae encampment, which they refer to as the Pu'uhonua. That encampment is not actually on the Waianae Boat Harbor property. It's actually on a partial Division of Aquatic Resources property between the Waianae Boat Harbor and Waianae High School. The approach we're taking in that area is really talking to individuals in encampment, really being able to understand their needs, bringing service providers to the table. And we've had a number of meetings with individuals from that community, including not just individuals from the encampment, not just my staff, but sometimes as many as 20 people or more in the room, really figuring out how can we best provide services to respond to their needs. So just like our state framework is comprehensive, as we're responding to these individual encampments, we're taking that same type of comprehensive approach as well. And in Waianae, it really is about recognizing that the parcel of land these individuals are on, the reason why it's under jurisdiction of Division of Aquatic Resources is that that property is home to ankyline ponds that are only found in Hawaii and have a unique line of opaiula or Hawaiian red shrimp that are only found in that area. And the mission of Department of Land and Natural Resources is really to protect the environmental and cultural resources for the public trust. So part of the discussions we're having at the community is how to balance the mission of DLNR with the needs of the individuals who are staying there. As I mentioned before, when we're addressing this issue of homelessness, it really is all about people understanding their needs and trying see how best we can to respond to their situation and get them onto the path to permanent housing.
Okay, we need to wrap this up, so we're going to take a little break and take pictures with those of you who received the certificates. So if you could gather for picture taking, and then following that, in about 5 minutes or so, we're going to resume with our media availability for